Bone, joint, and muscle injuries. Injuries to bones, joints, and muscles are called musculoskeletal injuries, and this type of injury frequently requires first aid. A fracture or broken bone can be identified by a deformed or painful body part, swelling or discolored skin, or an exposed bone. The person may have heard a snap or crack, may be unable to use the limb, or may be showing signs of pain or shock. With a dislocation, bones at a joint are no longer in proper alignment, and ligaments holding the bones in place are torn. The joint is often deformed and can't be used. There's swelling and signs of pain. Sometimes it's hard to tell a severe sprain from a fracture, but it's not necessary to know the exact injury in order to give first aid. Call 911 for a large bone fracture, deformity, or dislocation, except those on the hand or finger. To provide first aid for fractures and dislocations, immobilize the area in the position it was found. In the case of an extremity, also immobilize the joint above and below the fracture. Do not try to straighten an injured extremity. A person with a hand or foot fracture may be splinted and taken directly to the emergency department. In the case of a large bone fracture, or if an injured extremity is blue or extremely pale, call 911 or the local emergency number immediately, or shout for help. Help! And get someone else to call. With an open fracture, use a sterile dressing to cover the wound. If you need to control bleeding, apply gentle pressure around the fractured area. Do not use an elastic bandage with an open fracture, because it has the potential to cause more damage. There is a general first aid procedure you can use with most musculoskeletal injuries. It's known by its acronym RICE. R is for rest, I is for ice, C is for compression, and E is for elevation. First, rest. Do not move the injured area. If help is expected soon, splinting is usually not necessary. But if help is delayed, splint the injury to keep the area immobile and keep the bone or joint from becoming worse. Second, ice. Place a plastic bag or damp cloth with an ice-water mix on the injured area to reduce swelling and lessen the pain. Put a barrier, a cloth for example, between the plastic bag and the skin. You can also use a cold pack. Apply the cold for 20 minutes, 10 if it causes discomfort. Then remove it for 30 minutes. Repeat the process for 24 to 48 hours or until medical help is obtained. Third, compression. Use an elastic bandage on the injured extremity to reduce internal bleeding and swelling. The bandage can be wrapped over an ice water bag. Finally, elevation. Elevate the injured extremity to keep down the swelling and reduce possible internal bleeding. A sling may be used for arm injuries. You can splint any injury in danger of harm from movement if help will take a while to arrive. And you do splint a hand or foot injury if the person has to be taken to the hospital. Now it's your turn to practice.